If you are interested in a career that puts you in direct contact with patients as their assessor, advocate, and caregiver, then nursing may be the career for you. The team at Citizens Health in Colby has a look at the critical role nurses serve in the healthcare industry.
Supervisor, ER nurse, OB nurse, work acute care. I was interim floor manager for 3 months when they were going through a process of changing director of nurses. So I can tell you I like more hands-on nursing than I like book nursing. So.
I think what I love most about the nursing profession is every day you're making a change in somebody's life.
There's a lot of diversity in nursing too, so you have lots of open doors and opportunities to do things. You're not stuck with just one thing.
I like that no day is ever the same. I like the diversity and just the care that you get to give. You can take care of a baby one day, help bring a new life into the world. The next day, you're caring for somebody who's acutely ill or somebody who's injured in an accident. And you're just never the same.
What I love most about the nursing profession is being able to encounter people on a daily basis, like in their hardest times, whether it be a scheduled surgery or whether it be like sickness or end of life, just being able to be there for patients and their families.
Get lots of respect. Love my coworkers. I love coming to work every day, seeing the different variety, taking care of patients and their family. Just love all the areas, the interaction with the doctors.
I think for me the best part of my day is, in a smaller community you tend to know a lot of your patients, and just when they're in the ER and they're having a horrible day, something's gone wrong, and you walk in the room and they recognize you and they're like, oh, thank God you're here, or they give you a hug and they recognize that, and that just knows that, I've made a difference and that they can trust me to help care for them.
Yeah. And along with that being small hospital, you're coming into a family, so you work with people you enjoy to be with, and you know a little bit more about each other too.
And that trust with your teammates too. I mean, when it gets crazy and hectic and stuff's going every which way, you can all pull together as a team and just do what you need to do to get it done and care for your patients.
I'm a morning person, so I love the day shift, getting up early in the morning. As a supervisor, making assignments for the staff, kind of seeing who your staff members are to give them the acuity of the different patients. I like having, that they are maybe only able to have 3 or 4 patients, because I think the task role can get done that way. So collaborating with the physician, making rounds, making sure the patient care is getting done. That's the biggest part, and as well as charting, that's the other factor in it. So
every day as a nurse will look different, depending on what department you work in. Ideally, your morning would start with patient assessments, just checking in on them, seeing how they're doing, obtaining vital signs. And you're doing all of this from the assistance of other staff members, such as nursing assistants as well. And then you pass your medications to your patients, and then patients typically have physical therapy throughout the morning or different tests and procedures. Doctors round at that time, so you can go around with the doctors and when they're visiting your patients, and really be able to take part and say what's going on with the patient and advocate for your patient as well. Then, you have your 3 meals during the day. And the afternoon often will be filled again with medications, patient therapies, rest, and you just attending to their needs. If you work in the emergency department, it depends on what walks through the door, and you have no idea what that's going to be. So it's kind of fun. Every day as a nurse is going to look different. No 2 days will be the same. And I don't like routine, so it's perfect.
As a nurse, I feel like you need to have good communication skills. You need to be organized, be able to critically think, be able to assess a situation and identify what the issue is and know how to kind of help fix that. You always, have your doctor there to help you too, but the nurse is the one that's with those patients 24/7, and they know what's going on with that patient. So you have to be able to identify that and have a way to fix that.
Some skill sets that are really important for the nursing profession include adaptability, so being able to go with the flow, change your plan throughout the day depending on patient needs, being able to advocate for your patients, to stand up, talk to the doctors, whatever the patient needs, being able to do that.
Compassion and caring to me means even on your worst day, you're still coming to work with a smile on your face and helping your patients getting through what is their worst day. So you're always present.
Because as a rural nurse, you get to do it all. It's not like you get to go and specialize in the ER or OB or whatever, and as you do in a bigger hospital. It's important for those nurses to stay up on top of that, and it just makes a difference for our patients because they have to come to us first in order to get stabilizing treatment before they can be transferred anywhere. And a lot of times it's important to get things treated timely. It just helps improve those outcomes for those patients.
Nurses can have any type of schedule depending on their lifestyle. You can work day shift, you can work night shift, you can work 8 to 5 hour shifts, you can work 12-hour shifts 3 times a week, which is what I do as a nurse. Most hospital nursing shifts are 6 to 6 or 7 to 7, both day and night shift. But it's really flexible too. So if you want to work part-time, you can do that. You can work full-time. You can just work on an as-needed basis. There are travel nurses, which are always needed too. There's just such a need for nurses that you are able to have a schedule that fits your lifestyle.
I think majority of nurses have always kind of started out as like a CNA and kind of worked in that aspect, and then attended nursing school locally and just liked it here and stayed and just kind of worked our way up the chain of command. And then as far as like, you kind of find where your passion really is after being a nurse for several years, and then you just kind of decide, I want to make more of a difference and step into maybe a leadership position or a supervisory position. And it's just kind of, that's the great thing about nursing, is there's such diversity. You can go anywhere and do anything.
The first step is definitely just getting in the door, and CNA or anything along those lines, a lab tech or whatnot, to really dabble in what you do in healthcare will help open your mind and the doors for what could be next.
I want to welcome our panel of nursing experts to answer questions about the career opportunities in nursing. Joining us this morning from Citizens Health are 2 registered nurses, Ashley Lambert and Vicki Dennis. Good morning.
Morning.
Well, thank you so much for joining me. And I know you guys have a very busy schedule, so really appreciate you carving out time to be with us this morning. I wanted to start with a couple of questions that we often get that really you can each answer. So what is the most used skill that you do as a registered nurse every day that you learned in nursing school?
So I would have to say that would be just your basic assessment. No matter what you're doing, you're going to assess that patient, and that is a huge skill that you need to know what's going on and move through your day. It helps you read the room and find out lots of different things about that patient.
I'd say maybe communication. It's something that you do constantly through your shift, whether it's to your patient, to your doctor, to your fellow nurses, just because it takes everybody to care for that patient, and everybody has to be understanding of what's going on.
Another question for both of you. How do you communicate with patients and their families in your role as a nurse? You just mentioned communication. It was mentioned in the video. So, how do you best communicate with their patients and families?
Oh gosh, you're constantly communicating with them from, their admission to why they're being admitted to then you're also reviewing medications with them that maybe the provider started and they didn't understand what was going on at that time to then, okay, what's it going to look like when I get home? So your whole day is about communicating with them, their family, your providers, and your fellow staff.
And just communicating what you're doing with them and why you're doing it so that they can kind of help understand what's going on with their plan of care and what's the expectations, and just so that they know the big picture, because they need to know what's going on with themselves too.
Well, we have hundreds of schools joining us today and thousands of students tuning in, and I know they probably have questions for you. We have a chat feature. If you haven't used it yet, please put your questions and comments to our panelists in that chat feature. And right now, I want to turn it over to Jaron to see what kind of questions are coming in from students. Jaron?
Thank you, Cindy, and good morning to the both of you. A couple of questions have come in the chat regarding, how long does it take to become a nurse? And some students are aware that there's maybe the associate degree of nursing path and the bachelor degree path. Can you speak to that a little bit? Are there differences between whether a student should go one way or the other? And maybe share through your journeys, did that prepare you for where you're at today? And advice, I guess, for a student if they're looking to try to decide between one or the other.
So you can do the associate's degree path, which is a 2-year program, usually at a community college. And that's what I have done myself. And I've been able to work here at Citizens Health for the last 23 years. And that has suited me fine. I've taken my bachelor's courses also just kind of to help with the leadership aspect. Some hospitals do require a bachelor's to work in their hospitals. It just kind of depends on like what you want to go into with your nursing career and where you want to work.
It's all just what's going on in your life at the moment. And there's so many options. You do not have to do a 4-year from the get-go. I personally took every little step I could. So did CNA to LPN to RN and then to my bachelor's. So, and that allowed me to work and be hands-on and learn while I was also in school. So.
Well, thank you both. And you just mentioned the CNA part. And so we did have a question about, CNA is often one of the certifications that students, if they're in high school or really anyone looking to get their start in the career, they can take. And so would you say that it is best to get your CNA beforehand, or would someone do just as well as a nurse without having their CNA?
It's all what you put into it, but personally, you should get your CNA as soon as you can. It gives you exposure. Maybe you've always wanted to be a CNA and help people, but when you get in the field, it's a lot different too. So you find out if you even like it. So it's a great choice. It is something that is required in most nursing programs now. It helps you in the long run and it helps you in class. You can relate to a lot of things that you see nurses doing while you're a CNA also.
And you continue to use those skills even as a nurse. So I think it's a very good way to start because you continue to use those throughout your whole career.
I appreciate it. Thank you. Next, what are some differences you face in nursing depending on which shift you work?
Differences in the shifts. I usually work in the ER, so it just really depends. Some days are a little bit slower than others, and some are just chaotic. So you have to really prioritize and kind of try to work through the situation and figure out how you can handle the situation to make it work so you're taking the best care of your patients that you can.
Staying organized. It's a lot of organization, and I believe someone said before too, not every day is the same. So really knowing how to adapt to what's going on for that day.
The next one, how do you maintain a good work-life balance, and do nurses have to work mandatory overtime?
We personally do not do mandatory overtime at this current moment. I've been here almost 10 years, and knock on wood, we have not made that a thing. COVID hit, and that was a weird time in our life, and we asked a lot out of our associates to come in extra. It was optional, and being rural, a lot of our team stepped up and came in and helped. So as far as balancing, you find something that makes you happy outside of work. You have to have a moment to de-stress. So mine right now is my children. So you find a book, you go do sporting things, you cook. You have to find something outside of work to de-stress.
And you also have your peers. You know who you can kind of vent to in a respect, or just as managers, we're usually here 5 days a week. And when things get stressed and busy, we're here all the time and try to kind of compensate for a day off here and there if we can. And we really rely on each other too to help manage through those tough times.
Well, I think we have time for 2 more questions. So our next one that we'll go to is, what happens if a patient starts to get violent when you were trying to assess them and take care of them? And do you experience that often?
So that's something that's kind of a whole new world, I feel like, since I've started in nursing, and it's becoming more and more frequent, unfortunately, in today's world. The main thing that you always have to remember as a nurse is your safety is your number one priority, because you can't help somebody if you're injured. And that's what I try to teach all of our staff and kind of focus on that. Just try to remove yourself from the situation if you can, and then just also try to make sure the patient is safe, so that they don't harm themselves. We actually teach class here on how to de-escalate situations, and then also how to use some kind of like non-violent skills and like just some holding skills to make sure we can help our patients be safe.
And then I think this is our last one that we will have time for. So for both of you, what is your favorite part of your job, or a favorite area or department that you've had experience working in?
So mine's the ER. I'm the adrenaline junkie. I like that. Unfortunately, when people are having their worst day, knowing that I can be there to help them. And I just love that quick pace. I love that critical thinking and just being on my feet and just go, get it done and get them taken care of.
I don't really have a favorite. I do a lot of acute care med surg, so you see a lot of everything, but I've done OB too, and that to me means the world to me, being able to help someone bring new life into the world. And so that's just fun and exciting. And then, yeah, I don't know.
I just think as a rural nurse, it's great because you get to do it all. OB's not necessarily my favorite, but we can go and we can do it. And we're a team and we all get in there and do it together. So
yeah, it is. It's a little family, and it's not the same thing every day. I like change. So I get to see new faces and everything every day.